bring to you every morning here on HRB Breakfast, featuring Dr. Seshni Mudlia. And we've been doing this since the 2nd of February. By the way, before we continue, I'd like to say good morning to you, Valma James. I know you're listening this morning because you just sent me a text to say you're listening. So, Valma, how are you this morning? Just chill and relax and listen to listen to Dr. Seshni and I do the COVID update. And right after that, I promise you I'm going to play you a song, Valma. And I'll probably see you later on in the day. How are you, Dr. Seshni? Good morning and welcome to the show.
Good morning, good morning. What a lovely morning. And happy Easter to you and everyone listening.
Yeah.
It's absolutely amazing.
Yes. So, well, the first thing I want us to talk about really is the COVID passport situation.
Yeah.
Okay. Right. And the headlines today on BBC, they're talking about the fact that dozens of MPs are criticizing what they call the divisive COVID passport.
Yeah.
In fact, the former leader of the former Labour leader, Jeremy Corbyn, and the Tory senatorial member Ian Duncan Smith, they are among 70 MPs to launch a campaign opposing COVID passports in England. What do you think?
Yeah, well, I think there's obviously concerns around the passports, in terms of equality, ethics, and access to it. So there's obviously lots of information and discussions needed to be, obviously they need to discuss about the COVID passport. It's something we knew about very early on. We've been talking about it, I think, from the beginning, that there's a possibility we might have this immunity passport or this COVID passport. So I don't think it's a surprise that we're obviously hearing about it now. So, but obviously Hancock raises long COVID worries as...
Yeah, I'm not surprised because we'd always we'd always suspected, if all the way from last year, we'd suspected that there's something like that probably is going to pop up one of these days, and they're going to say, well, if you haven't got, we even compared it or linked it with the yellow card, the immunization card that people carry around with the yellow fever immunization, blah blah blah, and so we thought about. But for and against, well, one of them is that you cannot force people to get the vaccine, even though we are advising that people do get them, but you can't really force them. So if you put something like that in place, then you sort of taking away the rights of people. They can't travel, they can't get jobs, they can't even go to pubs without a COVID passport. Then one school of thought is that it's wrong. Like just like these 70 MPs are saying, like, look, you're taking away people's liberties. You're asking them to show a paper or show something that they've been vaccinated or they got negative COVID tests to go into a place. So that's that school of thought. The other school of thought, the other side of the coin is that it's going to help prevent the spread of COVID-19. Because, for example, if you're going to a pub and you've got you are asymptomatic, you've got COVID-19, and you just walk in, then you could infect other people there. So it's two things really. But where do we draw the balance?
Yes, so I think that's what they're saying, that they are considering the vaccine passport as a way of bringing people back to offices and factories. So some countries are already using them, while others are weighing up the risks and benefits. I mean, the in terms of equality and ethics, obviously there's concerns because with the COVID passport, as you said, not everyone is taking the vaccination, and maybe because of underlying physical health reasons, for religious reasons, or for whatever reasons, they're not taking the vaccine. So what will happen in that case if we do get the immunity passport? How are they going to be able to show that they don't have COVID? So whether it's just through testing, will there be exemptions for people without that don't want to take the vaccine. And then on the other hand, obviously, it's it seems that it's going to impact on work, because if it does come into effect, because that's what they're saying. So to get people back into the work, into factories, into offices, they're going to have need a passport. So not just for traveling, it's going to impact on every aspect of our lives. And again,
Yeah.
it poses a lot of ethics and equality. So there is obviously there's pros and cons for it, but and I'm not surprised that 70 MPs are going against it. But we'll see, because they did earlier on, we heard about a week ago, where they were talking about the possibility of pubs, starting to have the passports, and that didn't go ahead. So let's just see what's going to happen next. But some people are saying it's inevitable in the next phase of the COVID-19. So it's something, as we said, we knew about. We've been talking about it for some time, because we spoke about how
Yeah,
China
we
has
have, yeah.
the immunity passport, and this is something for the last year has been on the horizon. So there's been discussions, but yeah. So apparently in United States, certifying a person's immunity to COVID-19 is inevitable to get back life to normal in the United States, according to a growing number of health
Mm-hmm.
experts. So obviously it's not just in the UK; it's all over that they are working to launch these passports. So
Actually,
even, so
actually,
even
some
sorry, so just so I was
actually sorry, some airlines are considering that now.
yeah
They're gonna try and put that in place. That if you had what you call it, a vaccination passport, or the COVID passport, then you can travel on the airline. Otherwise, you will need to do the COVID test, like
yeah
we're doing now. And some of the airlines are saying that if you had the COVID passport, like if you've been vaccinated, you've done your 2 doses, then you wouldn't need to test. You just show your certificate and fly.
yeah.
So yeah, so
So
we'll
yeah,
see.
I mean,
Mm.
as you're saying, so with traveling, it's going to be more and more common that people are going to need to show, and that's understandable with traveling. But just to say that obviously the European Union, China, Japan, they're all working to launch their own digital programs, while Israel has already unveiled a green passport. So they're going to be used gradually and safely to reopen the world by allowing people to dine or exercise outdoors, and across borders, in neighboring countries. And this is to reduce the outbreak. So obviously, if someone has an immunity passport or COVID passport, what they're saying is it's going to minimize the risk, because they've been vaccinated. There's a lesser chance of them getting it. If they've got a negative test, obviously there's a lesser chance of spreading any virus. So New York has already begun its own digital certification, known as an Excelsior Pass, which will allow residents into public establishments. So yes, so we're gonna be. So this is just the beginning of the immunity passports. That we. So it was. So in last year, what they're saying, before coronavirus, vaccines were authorized for use by the World Health Organization. The idea of immunity passports was discussed, but they pointed out it carried several logistical and ethical factors. So governments should seek to prevent immunity certification policies, public and private, from making disadvantages worse in terms of opportunities for healthcare, employment, housing, and so forth. So it doesn't seem like it's something that the WHO is actually, um, promoting. I think they're trying to have a more, democratic view in terms of, having it because of the ethical and obviously the equality reasons. So it'll be interesting to see what happens.
Okay. Now let's talk about care homes now.
Yeah.
And this story, I think this will really interest Valma because she's very passionate about carers and the people we care for. She's really, really passionate about that. So, but the story says ban on care home residents taking trips faces legal challenge, and campaigners have started legal action against the government over guidance that bans over guidance that five and over from taking trips outside the home. I never knew this was the place. This is the first time I'm learning that if you're in a care home and you're aged 65 and over, you couldn't take trips outside your home. And these people are also challenging the requirement of residents for residents to self-isolate for 14 days after such.
Yeah. So obviously that's
what's your take on this situation? Like, if you're in a care home and you're 65 and over, you couldn't take a trip outside.
That's quite strict, isn't it?
I find it a bit strange, but
that has to do a lot.
I never knew this was in place at all.
Yeah. No, I also I mean, obviously we knew that people were isolating and also were in quarantine, and obviously there were strict measures in care homes that they were not allowed to have visitors. So that was something which was known. Yeah, just sorry, just before we... Sorry.
They can have visitors.
Yeah, so I think there was...
That's been lifted now. They can have visitors.
Yeah, now they can, but before it was quite restricted. They were restricting the amount of visitors that they were receiving, as well as also the type of staff that were actually working in the care homes because of the risk of... Because we know that in the care homes, very early on, we had a lot of care homes, especially old age homes, where we had people getting infected. So yes, I think this is a bit of a surprise. And good morning to Valma. Sorry, I know you've mentioned her twice. So hope she's listening. And yes, Valma's really proactive in terms of carers. So yeah, I would like to know what her take on it. But for me, it sounds like it's a deprivation of liberty. It could be, depriving people of their liberty in terms of, being able to go out. That's quite restrictive. But that's on the one hand. But on the other hand, um, obviously we know the reasons why it's there is because of their safety, because they're in the vulnerable age group. They're probably in the group that was shielding. So this group of people need to take extra precautions. So I think obviously it is a concern, but at the same time, we need to weigh the risks and benefits. So it is going against what they would want, in terms of going out and being able to have that freedom. But on the other hand, we need to understand that this is done for their safety. So, yeah, I mean, that's what, yeah, I do understand. It's quite a tricky one, I feel, but yeah. And what is your take? So you think what do you feel?
Well, I don't know. It's quite restrictive.
Yeah.
At the same time, I think the government they put these things in place to protect these same people because they're vulnerable. So well, there's argument for and against, but I stand in the middle, to be honest. And, yeah, I do. Now, I just got a text from Vama, and she's asking this question. She's asking, are people being charged for the test when they return back into the UK? Yes, Vama, yes, that's the case. And Vama is saying that her friend came in from Cameroon, and she had to pay £200. It's actually £110 from the country that you're traveling from.
Yeah.
As long as you're coming to, and it's compulsory, you'll have to pay. You pay £210, and that and then when you get into the UK, you'll have to self-isolate for 10 days. And you get a home test kit on the second day. So you do a test on the second day and another test on the 8th day. That's the rule, and that's what you're paying for. You're paying for the £210.
Yeah. So that's what
you're paying £210 for the home kit.
Yes, thank you, Velma, for that question. It's really important because, especially now when the lockdown measures are eased and people are going to be able to travel from the 17th of May. So,
yeah,
yes, from my understanding and from reading up, it is correct. You have to pay. I think I read a figure about 180 as well. So, it can be anything from 180 to 210.
it is actually 210 pounds. It
Okay.
is. That's
I did
that's
read
the amount.
somewhere about 180 pounds, but it might be different
Mm,
countries. But so it can, so basically you have to fit the bill. You have to pay for the testing and get
yeah,
tested. Make sure that you've obviously got a negative testing when you come back into
yeah.
the country. And yeah, so it's yeah,
Well,
definitely.
I think a lot of people are not happy about it. The reason is because it was a bit. For example, a friend of mine who traveled from Ghana into the UK. They didn't tell him when he was going, and the airline didn't say anything. Nobody. So you get to the airport, and just whilst you're checking in, they ask you to pay £210. You ask, what was that for? And then they tell you what. That's a UK directive. You cannot go into the UK without paying £210, and that takes a lot of people by surprise. And the question is, what if you haven't got the money there?
Mm, yeah,
Especially if you've not been told, But if you now that people know, it makes a bit of a difference because you know that when you're back into the UK after you traveled, you need to save £210 and pay.
yeah,
So now but when it's a case where you don't know, the airline doesn't warn you, the airline doesn't say, okay, well, you're coming back on the 4th of January or something like that, and just remember that you'll have to pay £210 at the airport. The airport of departure where you're leaving, you pay £210. Otherwise, you cannot come into the United Kingdom. Yeah. Then you have to pay for it, and it doesn't matter if you're a British citizen or not. You have to pay.
Yeah.
£210.
Yeah.
Yeah.
So that's
and then you get here, and then.
I hope that answers your question, Velma. And if they, keep the questions coming in. It's always good to have these questions, and because to raise awareness, because some people don't know what's going on, and they might be thinking of traveling, but now they know they need to pay for their own testing.
Yeah, and there's been a few problems with that as well, because there's been cases where people have, and we did that some time ago, if you remember, we did this on the COVID update. There's been a few times where people are waiting for their kits, and then the kits are not arriving, even though they paid £210.
Yes.
They're self-isolating for 10 days. They're staying at home, waiting for the first kit to arrive the second day, and it didn't, and the 8th day, and it didn't.
Yes.
So there's a few, and then they'll come back and apologize and say this and that, but you would have finished your quarantine already. So there'll be no point in doing the test anymore. You would have paid £210 already.
Yeah.
But then I think things are getting better. I think they're getting their act together now.
Yeah.
So yeah.
So yeah.
Anyway, so Mama, that's your answer.
We'll probably get more and more discussions around travel, especially as we come to April 12th, and then so the next part of the roadmap when businesses open and salons open, and people will be able to dine outside and go to pubs. So, and then obviously later on when people will be able to travel to foreign countries from the 17th of May. I just wanted, I don't know whether you saw this, but Sicily health chief quits over fake data as it happens. So I don't know whether you know much about that, but
what do you mean?
So it's just one of the headlines. Sicily. So Sicily health chief quits over fake data as it happened. So I'm not sure what this is about, but it seems quite serious, I think, in terms of, so officials accused of fiddling Sicily's coronavirus data to keep region out of the red zone. So it seems that the health official resigned on Tuesday amid investigation into whether the regional coronavirus figures were manipulated to cover up rising infection rates and deaths. So yeah, that seems to be something that's happened, which obviously is a bit of a concern, I would say. Yeah.
Okay. All Okay, let's it's 20 minutes past 7,
Yeah, and
and
one more
we.
thing. Sorry, just I don't know if you saw this, but in terms of the news, they're saying there's possibility that there'll be no more lockdown, while Britain will treat COVID like a flu. So there's a possibility after this lockdown that we will not go back to a lockdown. So that
Yeah, I haven't seen that article, but I've always had a feeling that lockdowns will be a thing of the past. The reason is if we keep locking down and locking down and locking down, then the economy is going down and down and down. But I believe that we've gotten to a stage in this whole pandemic situation where it can be controlled somewhat.
Yeah.
Do you understand? So we probably wouldn't need any more lockdowns, but then they're going to put strict measures in place to control it.
Yes.
So that the economy can move on.
Yes. So that's quite important. I think that's probably good news for everyone. That, and I agree with what you're saying. The point is that if we're going to continue with lockdown, the economy is going to suffer. So it's going to be a matter of that we will not have any more lockdown, but obviously very strict guidance, strict protocols, strict measures. And continue to wear masks, social distance, using hand sanitizers, and essential and non-essential travel. So and obviously with institutions that are open, public places, businesses, offices, all will still be encouraged to work from home as much as possible. But obviously, some places will open, but with restrictions. So yeah, so I mean I think that's quite good news. So it sounds very optimistic. I'm going to come to the numbers, but just before we continue, just important, because I think a lot of people are traveling and planning their holidays and looking at what they're going to do. So what they're saying is that holidays destinations abroad to be graded using a traffic light system, says reports. So that means ministers are reportedly planning to waive restrictions for travel to green countries with low coronavirus rates. So there's going to be a traffic light system with fewer restrictions for places with coronavirus rates and high vaccination take up. So countries will be graded, so like a traffic light, a robot, as we call them as well. It will be green, amber, or red, according to how well they are coping with the pandemic under the government plan for resuming foreign travel. So there will be plan to return travel from the green listed countries would be exempt from quarantine measures. So that's fantastic news, I think. So obviously the red list countries will be banned. So travel to and from will be banned. And said that those arriving back in the UK from destinations will have to pay to stay at quarantine hotels as it is set up for the worst um, effective countries. So obviously if you can't traveling to and from a country which is on the red zone, you will need to quarantine. So that will still go into effect. So yeah. So that's obviously, and there's a fine of £5,000 for anyone who tries to leave England before the 30th of June without a good reason.
Ooh, without a good reason. Okay, thanks for the information. That's very helpful. And following up on Valma's question, she also asked if the £210 test situation applies to children. To be honest with you, Valma, I don't know now, but then yes, it did, because my friend had to pay for his daughter, so because he was traveling with his daughter, and he had to pay for his daughter as well. But I don't know. I'm not going to sit here and tell you I know 100% what the situation is like now, because I don't. But we'll check that out and we'll let you know.
Yes, I will also find out as well whether it is for children. So I'm not sure at the moment, but that's really a good question again, Valma.
It is a good question. Let's just research and then we'll get back to Valma on that one.
Yeah. So so obviously that is so testing. They do say so children. So I've just got information from the www.gov.uk, and it says that you must have proof of a negative test to travel to England. If you arrive without a test that includes this information, you may have to pay £500 fine. Children age 11 and under. So I'm just getting that down. So children age 11 and under um, will be exempt from that. So
Well,
yeah,
so that's a new rule then, because my friend's daughter, she's under 11, but she had to, he had to pay for it.
yeah, they just say that
So
children.
it's probably changed now.
Yeah, they think children age 11 and under do not need to take a test. So I'm just trying to see the more information on that part because, and that's on the government website.
Uh,
So there's exemptions people do not need to take. So children
yeah,
and medical.
if we just drop that for now.
Yeah, but anyway, they say that children do not
Sorry,
need
if
to.
we just drop that information
Yeah,
for now,
children
that
do not
research
need
for
to
that,
take the test. I mean, that's on the government website. But yeah, that's done. Yeah, thank you.
all right, okay.
So
Okay
as a
then.
company,
Okay.
the time is just
Yeah. So
gone.
what to the numbers now, please?
Yes. So as it stands today, the 2nd of April. We just passed April Fools yesterday. So 2nd of April 2021, the Worldometer figures as it stands is 130,206,710 positive cases. Total number of deaths is 2,840,729 deaths, and total recovered is 104,922,225. And in terms of the top 5 countries, USA number 1 with 31,244,639 with 566,611 deaths. Brazil number 2 with 12,842,717 positive cases with 325,559 deaths. India number 3 with 12,303,131 positive cases with 163,428 deaths. France number 4 with 4,695,082 positive cases with 95,976 deaths. And Russia 4,554,264 positive cases with 99,233 deaths. UK 4,350,236 cases with 126,764 deaths. And coming to South Africa, number 18. So they've moved to number 18. South Africa's doing well.
Yeah, they've moved to number 18 now, yeah.
With 1,549,451 positive cases and 52,897 deaths. And Ghana, number 91 with 90,583 positive cases and 743 deaths. And England, in the last 24 hours, when I checked earlier, 51 deaths in the
Do you mean the UK in general, or is it just England?
UK in the last 24 hours was 51 new deaths, every life matters, and 4,478 positive cases. So figures have definitely gone down. Yesterday was 43 new deaths and 4,052 new cases. So it's definitely seems like things are on the, things are looking really good. So yeah, that's a good note to end Easter. And again, happy Easter to everyone that's celebrating. What an amazing celebration. And just to, to remember what it's about. It's about Jesus, and it's such a good, it's such an amazing celebration, I must say, over the Easter weekend. And we definitely going
Absolutely.
to honor and cherish, the celebration and the reason why we celebrate Easter because of Jesus. And
Yeah.
but you'll be discussing more of that, I think, on your Sunday best.
Yes, on Sunday best. I have three guests really. I've got the Reverend William Sunu of Joy Christian Center, who's going to come and talk to us about the real meaning of Easter, what it really means, and then have this amazing gospel musician, and she's also a counselor, certified counselor. She's going to come and talk to us about her gospel music career, really, and also she's coming out with an album or a single rendition of the song "Oh Happy Day."
Oh wow, yes, I saw that.
Christians all over the world are celebrating the resurrection of Jesus Christ. So it obviously is a happy day. And then to top it all up, we're going to hear our Easter message from our own Her Majesty's Lord Lieutenant of Bedfordshire, Helen Nellis. She's going to give us her Easter message here on Sunday Best and on Hospital Radio Bedford. So please join us Sunday morning at 8 o'clock British Summer Time or 7 o'clock Greenwich Mean Time. And let's have a celebration. Yeah,
amazing.
so that's it.
Sounds like amazing. You Christians all over the world will be celebrating Easter. So it's such a wonderful
Yeah, yeah,
celebration, to
yeah,
honor Jesus, and
yeah.
it's really
Yeah,
it's
and
amazing.
it's not just Christians really. It's everybody who believes
Exactly.
in God and
That's
believes
true.
in Jesus and all that. So yeah, people from all different religions and all that to
Yes,
celebrate Easter
actually,
together,
that's what I was going to
which is a
say.
great thing.
That's true. Like,
Yeah,
Christians, non-Christians. I know we grew up, believing in Easter, growing up in a Hindu family, then, getting into Christianity. And even in the
yeah,
Sikh Mahikari tradition we follow, the light tradition, they honor all religions, and Jesus forms, part of that, really important, honoring and remembering Jesus and his resurrection. So, yeah, it's amazing. Thank you, Poku. Thank you so much. And have a happy Easter, everyone. Lots of love from my family to yours. And lots of love, and enjoy the Easter celebrations.